Good morning, students. Today I come to you again with a new topic, which is the seventh nerve palsy, seventh cranial nerve palsy. The seventh nerve is also called the facial nerve. Why? Because it helps in facial expression. There's something you can just look straight forward with this picture. You realize that one, there are furrows or few contractions on the left side of the forehead, okay, but these are missing at the right side, and the individual has been able to close the left eye but has not been able to close the right eye. This straight away tells you that there is facial nerve palsy. Facial nerve palsy. To which side is the right side? Because it is the right eye which the patient is not able to close. All right, so let's delve into a few basics. So the facial nerve innervates what? Muscles of facial expression. Which are these muscles? All right, we have the frontalis muscle, okay, that when they contract, they bring about furrows, okay, horizontal furrows, all right, they bring about horizontal furrows on the forehead. Then we have the corrugator superciliary muscle, okay, that when they contract in an attempt to show surprise, they show vertical furrows, as you can see here. It's very prominent here, but it's not as prominent at this side, okay. Then we also have the procerus muscle. What does it do? It's able to lower the medial part of the eyebrow and attempt to show surprise. Okay, that is the function of the procerus muscle. All right. So, of course, another muscle of facial expression is the orbicularis oculi muscle, as you can see, a tonic concentric part. And you also have what? Orbicularis oris. Orbicularis oris. So, talking about the basics, okay, it's good to know that the seventh cranial nerve, okay, what the seventh cranial nerve supplies. It carries motor, secretory, and sensory fibers from anterior to terse of the tongue. Remember, it carries motor, secretory, and sensory fibers from anterior to terse of the tongue. Again, grossly, the facial nerve nucleus has two parts. The upper part, okay, upper part, things that are up, all right. The upper part, it supplies upper part of the face. Okay, what do I mean? It supplies the frontalis muscle, all right, orbicularis muscle, the corrugator superciliary muscle, okay, and of course the pyramidalis or procerus muscle. These are the muscles that the upper part supply. Then the lower part, okay, it may also supply some portion of what? The lower part supplies the orbicularis oris. The lower part supplies the orbicularis oris. So therefore, it's also good, apart from that, to know that it supplies certain glands, like the lacrimal gland, okay, which is found somewhere here. It also supplies the submandibular and the sublingual glands. So therefore, it has impact on secretion of saliva. Okay, very good. So therefore, basically, it supplies muscles of facial expression. So if it supplies the orbicularis and then the orbicularis oculi and orbicularis oris, when it is affected, don't be surprised that the mouth will be deviated and the eyelids cannot close well, because as we know, the orbicularis oculi is innervated by the 7th cranial nerve, frontalis too. Okay, so delve more into the. Now let's talk about some causes of uh, facial nerve palsy. What are some of the causes of facial nerve palsy? All right, it can be divided into upper neuron cause and then what? Lower neuron causes. Upper neuron causes and then what? Lower neuron causes. Okay, so what are some of the upper motor neuron causes of? First of all, how do you identify that we are talking about upper motor neuron 7 cranial nerve palsy? Okay, when it is upper neuron, okay, it therefore means that the forehead is what? Is spread. The forehead is what? Spread. Forehead spreading means that you are not going to have, for example, the whole face is what? Affected. If the whole face, the half face is affected, then it is what? Peripheral or what? Lower motor neuron. Okay, if the whole face is affected, it's peripheral or what? Lower motor neuron. Okay, but if it affects only the lower aspect, in that case, only the mouth, and the forehead is paired, it means that you realize that the person can contract, okay, the frontalis muscle. So that is about that. So you can realize that the whole half face is what is affected. This means that it's what? Peripheral or what? Motor neuron. If it is central or upper neuron, then it's only the inferior portion, which is what? Affected. And that the forehead will still have what? The contractions over here. Okay, that is if it is what? If it is upper neuron. So what are some of the causes of upper neuron? 7 cranial nerve palsy. Stroke can give you, that is hemiplegia. It can be caused by subdural hematoma, multiple sclerosis, primary brain malignancies. Then lower motor neuron lesion, okay, whose pictures we have here. That's the whole half face is affected. That's the lower motor neuron. Okay, lower motor neuron. Look at the whole half face is affected. Okay, so in lower motor neuron lesions, okay, what are some of the causes? These causes include, it can be what? Infective, from viral infections that are the most common. Which viruses may cause it? We have herpes simplex virus, herpes zoster virus, Epstein-Barr virus, cytomegalovirus, HIV, and the list is what? Long. Sometimes bacterial infection from otitis media can cause it. Alright, another source or another cause of lower motor neuron seminal cranial nerve palsy is parotid tumors. It can also be caused by trauma to the nerve. Okay, and of course, Bell palsy. It can also be caused by what? Vaccines. Vaccines against COVID-19 have caused a lot of 7 cranial nerve palsies. All right. Okay. So let's talk about the symptoms that clients who have 7 cranial nerve palsy will present to you with. Okay. First of all, I want you to know that 7 cranial nerve is quite broad, but we are talking about the aspect which is of ophthalmological importance. Okay, so some of the symptoms include difficulty in facial expression, all right, especially at the affected side. They have difficulty in speech, of course, knowing that there's these nerve supply the facial muscles of expression. If it's affected, there'll be difficulty in facial expression. Number two, there'll be difficulty in speech. Why? Because if your mouth is deviated, okay, look at the corner of the mouth is deviated, all right, then you have difficulty in speaking. And of course, your tongue, I told you that the tongue is supplied by the 7 cranial nerve. Without the tongue, you can't speak well. Okay, so the tongue becomes affected, and that will affect your speech. And then there's difficulty in mastication. If your mouth is not straight, okay, and the tongue is affected, this will affect your chewing or mastication. They also have difficulty in what? Closure of the eyelids. Okay? They have difficulty in closure of the eyelids. Have you seen? They close the better side, okay, with contractions on the forehead at the better right side, but the left side they can close it. So there's what? Difficulty in closure of the eyelid. And sometimes patients will come to you telling you that their mouth has what? Shifted. Okay? Look, the mouth here has shifted towards the left side. Okay? Mouth shifting. In other words, the mouth is not straight. So sometimes they have less or increased production of what? Tears and then saliva. In this case, he has increased production of what? Saliva over here. In other people, it is decreased. What are some of the signs of severe cranial nerve palsy? Okay, look at this gentleman's face very well. Okay, you realize that the frontalis have contracted. Why? Because you can see horizontal lines or furrows on the forehead. It means the frontalis muscle is contracting on the left side, but not on the right side. That is why the right forehead looks expressionless without any expression. That is about the uh, frontalis muscle. Okay, so you have lack of contraction of affected facial muscle. So you start from the frontalis. Look at the right side is not what? Contracting. Okay. All right. So other problem that you can find is that they have what? Incomplete closure of the affected eyelid. Incomplete closure of affected eyelid is better manifested here. You understand me? He has closed the right eye properly, but the left eye cannot be closed well because the orbicularis muscle that when it contracts closes the eyelids, its function is impaired because it's supplied by the seventh cranial nerve. So therefore, they have difficulty what? Closing the eyelids because the orbicularis function has been what? Impaired. Okay. So if you want to exhibit the signs very well, you ask the patient to smile, show their teeth, or whistle, and you know that the manifestations are well blown out, well elicited. Okay, so let's look at this particular gentleman who has lower motor neuron facial nerve palsy. In lower motor neuron or peripheral, so another name for lower motor neuron facial nerve palsy is what? Peripheral facial nerve palsy. How do you identify that? It means that the whole half face is what? Affected. Hey, ladies and gentlemen, let me tell you something. Almost everything is down, down, down because it's lower motor neuron. So everything is what? Down, 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 and down. For example, look, first of all, there's no facial expression at the right side. It's expressionless, but you can see some expression at the left side, which is the better side. So the eyebrow compared to the left better eyebrow, it is down. Okay, look at the right eyelid, it is down. Look at the right corner of the lip, it is down because it's what? Look at even the right nostril is down. So everything is down, down, down because we're talking about what? Lower motor neuron lesion or peripheral seven cranial nerve palsy. So let me go back. The eyebrow has drooped, the eyelid is drooping, the 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 nasal aspect of that side has drooped. Okay, the nasolabial fold is missing, and the corner of the mouth has also gone down. Okay, so there's lots of forehead wrinkling, inability to raise eyebrow, okay, drooping of the eyelid, flattening of nasolabial fold, okay, and drooping of the corner of the mouth. So this patient has what? Right facial nerve palsy. Okay, yes, right facial nerve palsy. Again, look at this other patient. All right, you realize that the frontalis is contracting on the right side, but not at the left. So this gives you the impression that we're talking about what? Left facial nerve palsy. There's expression at the right side, but not at the left. So we're talking about left facial nerve palsy. You need to determine whether the palsy is at the right or at the left. In this case, it's at the left. And it's what? Peripheral or lower motor neuron lesion, or peripheral or lower motor neuron 7 cranial nerve palsy. Everything is down, 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 and down. Look at the eyebrow. The eyebrow is what? Is down. Upper eyelid is down. Lower eyelid too, in some circumstances, is down. Okay. Look at the nasolabial fold. Okay, it is down, in fact lower than the beta, but it's not prominent. It's not seen because there's expressionless aspect of that side of the face. Look, there's drooping of the corner of the mouth. Is down. Okay, compared to the other side, it's lower. And in fact, this person is over secreting what? Saliva. Okay, so there you are. Okay, look, in this particular circumstance, the lower eyelid too has dropped down. Okay, so we say ectropion when it is what? Showing down, because the 7 cranial nerve helps the eyelid to close well, but now that it is paretic, the eyelid cannot close well, and so it can also be found showing outward or down. Okay, so ladies and gentlemen, look at this other picture here. Okay, he has been able to close the right eye but cannot close the left eye because the orbicularis oculi is affected. They cannot close it. And if the picture were to be complete, what do you think will happen to the other structures? The nasolabial fold, will it be prominent or faint? How do you think the corner of the eye, the corner of the mouth will look like? Will it be dropped or not? Be thinking about this. I'm going to ask you in class. But remember something, that when they cannot close the eyeball well, consider the eyeball as food in a container, and that container, instead of you covering it, you don't have the cover. What will happen to that food? It will be contaminated by germs. Similarly, patients may develop what we call exposure keratopathy because the eyelid cannot close well. The eyeball is exposed to the environment with all the bacteria, the germs, the viruses, infective particles, and they can develop what we call exposure keratopathy. Keratopathy is disease of the cornea and is exposed to the environment. So we say exposure keratopathy. Okay. Similarly, it can happen here because a part of the cornea is showing to the environment, and that is not good enough. Okay, right. So it might not be prominent, but if you compare these two eyebrows, you realize that the right eyebrow is a bit down. Okay, and if you were to see all the face, you realize the nasolabial fold might be absent, and then the corner of the mouth too will be what? Down. Okay, so look at this gentleman here. All right. If you look at him critically, there's expression at the left side of the face. Okay. But look at the right side. There's no expression at all. The frontalis muscle, is it contracting at the right side? No. Okay. All right. So what are the procerus? The procerus muscle. Well, before we talk about procerus, let's talk about the eyebrow. Is it not down? It is down here. Okay. The eyelid is a bit lower here than the better side. Okay. The nasolabial fold, how prominent it is at this side, but it appears almost absent at the right side. Look at the corner of the mouth. Is it not down? It is down. So we are talking about right facial nerve palsy, the peripheral part or the lower motor neuron aspect of it. Okay. Look at this other client here. You look at him critically, you realize that look at the eyebrow. Well, it is not fully blown, but it's it's at the same level at the other side. In science, you may not get things exactly the way you want every time, but what is clear is that the frontalis is contracting at the better side, whereas the right side, the frontalis is not contracting. If he were to make an attempt to close his eyes, you realize that the right eye will have difficulty closing. Look at the nasolabial fold. It appears what? Absent at the affected side. Look at the corner of the mouth. It has drooped. So what are you talking about? Lower motor neuron facial nerve palsy or peripheral facial nerve palsy. Okay? Similarly, look at this side. Okay? Then, so those are the clinical signs. So how do you diagnose it? The diagnosis is clinical. You take a very good history, okay? Then you examine the patient, all right? And then you arrive at a conclusion. You don't need any ancillary tests to use to diagnose cerebral cranial nerve palsy. In fact, the diagnosis is what? Clinical. Sometimes you may request for CT scan or MRI of the brain and orbit paranasal sinuses. But there's only one reason why you want to request for it. Other than that, there's no point. What reason is it? If there's a recurrence of the facial nerve palsy, then it will show what? Fracture or edema of the nerve. A lot of CT scans and MRIs that have been done for the brain and of the paranasal sinuses because of cerebral nerve palsy have shown that fracture or edema of the nerve. Okay, listen to this very well because in this management, this will come to bear. So remember that you don't just ask for this neuroimaging. There's only one condition that makes you ask for it. Why? If it occurred in a patient after management was over, patient was good, then it recurs, then that becomes an indication to do what CT scan or MRI of the brain. And other than that, there's no point asking for this ancillary test. So, how do you manage clients who have seventh cranial nerve palsy? So you manage the underlying cause, okay? You manage the underlying cause. But also remember that some clients who have hypertension, diabetes, even pregnancy, okay, can also develop this facial nerve palsy. And other times the cause is not even known. All right. So if it is a modifiable risk factor, that's hypertension, diabetes, then of course you can really work on these underlying systemic diseases. Okay. And of course, patient is going to be fine. So if the cause is from Bell's palsy, okay, whose cause may not be very obvious, observe from Bell's palsy. What do? You observe the patient for between 6 weeks to 3 months for spontaneous recovery. In majority of the cases, if it's not a pathologically recognized disease in the body as in tumors, okay, then and the cause is not really clear, within 6 weeks to 3 months, there's usually spontaneous recovery. But sometimes there are risk factors associated with poor recovery. In other words, if you are not getting the results that you want within this period, what could account for it? One, generally, patients whose ages are more than 60 years, recovery is difficult. Those who have complete paralysis, like this particular client, okay, recovery is difficult. Decreased taste or saliva flow at the paralyzed site. Another indication for poor recovery is decreased lacrimation. So when you have all these, it means that recovery becomes what? Difficult. Sometimes too you have sequelae or complications. Okay, so after the third, fourth months, if the patient has not had recovery, then complications or what sequelae might what set in. What are those complications or sequelae that may set in? You may have what you call synkinesis. Synkinesis, okay? Another sequelae that may happen is what? Hemifacial spasm. All right. So, but another one is what? Crocodile tears. So there are three. We have synkinesis, hemifacial spasm, and what? Crocodile tears. These are the three major complications that may set in 4 months if after 4 months if there is no spontaneous recovery. What is synkinesis? Synkinesis means well, divide the word into syn, that is happening at the same time. Kinesis refers to what? Movement or kinesia. Synkinesis, that is facial movement that happen at the same time. For example, if you look at this picture critically well, all right, you will realize that the patient has left facial nerve palsy. Okay, left facial nerve palsy. What is your evidence? One, at the right side, you can see some furrows on the forehead. Okay, all right. So, but may not have the same thing at the left. Okay, so what is this synkinesis about? Synkinesis here just means that when the patient tries to laugh, in laughter, a lot of the facial muscles are involved. Okay, you see eyelid closing. Okay, when the patient tries to laugh, which involves the orbicularis oris. Okay, the eyelid what closes at the affected site. All right, so there is left what facial nerve palsy here, and it's more prominent because the patient started trying to laugh, and synkinetically other muscles have contracted, like the orbicularis here, making it what synkinetic type of complication. So the other one is hemifacial spasm. Hemifacial spasm. So if you look at this client critically well, which part is the paralyzed side? Of course, the paralysis has happened at the right side. Okay, it has happened at the right side. Look at the right side. It's expressionless, but there's some contraction here at the beta side. So the cranial nerve palsy has happened at the right side, but the hemifacial, which is complication, is what happening at the beta side. Okay, and it is characterized by frequent involuntary contraction of facial muscles on one side of the face. Okay, so there is what involuntary, okay, contraction of what the facial muscles. All right, look at it. But the paralysis was at the right side, but the hemifacial spasm or contracture has happened at the beta side. Here, the patient voluntarily started to laugh. Okay, and look at the synkinesis of the orbicularis muscle and the orbicularis oris, and look at how it has manifested so much. The seventh cranial nerve palsy, that is involuntary. So, the third complication can happen is what? Production of crocodile tears. Remember, the same cranial nerve is involved in production of what? Of tears from the lacrimal gland and of saliva. So, ladies and gentlemen, what is crocodile tears? It simply means that when the client sees food, he might start salivating, okay, from the submandibular and sublingual glands. But at the same time, there is what? Lacrimation, because he saw food and started salivating. Okay, there is, I'll call it the seventh nerve that innervates the lacrimal gland also start what? Secreting. So the patient saw food, started salivating, and automatically started also tearing from the eye. This is what is known as what? The crocodile tears. Okay, so those are the complications. What are the non-surgical management? Okay, so we can talk about eye lubricants. Okay, eye lubricants. So if you have a client who cannot close the eye, you've seen this patient. Okay, whenever we close our eyes, there is secretion of tears which spreads evenly on the ocular surface. Now that we can't close the eye, he needs source of lubrication in the eye. So we give what we call what? Eye lubricant. Ulcer can even happen to the cornea. So it becomes ulcerative, give lubricants and what? Antibiotics. Okay. In the non-surgical management, you can give what? Oral steroid. Who can tell me why we give oral steroid? Well, remember that one of the major, when you do CT scan, it might show that the nerve is what? Inflamed or edematous, and steroids help in what? Reducing inflammation. That is the rationale behind the use of oral steroid in the management of clients who have what? Severe cranial nerve palsy. But sometimes too we give what? Antiviral agents. Why do we give antiviral agents? Yes, because this disease can easily be caused by viruses. I mentioned a whole plethora of viruses we can cause the disease. I mentioned Epstein-Barr, I mentioned HIV, herpes simplex, herpes zoster, cytomegalovirus, and even COVID-19, and the list continues. Okay, so therefore, giving antiviral agent is quite useful in management of these clients who have this type of disease. Of course, I've told you the underlying cause. Once you know it, you have to also manage it. But when you do combination of antiviral agent and steroids, you achieve better results still. Okay, so those are the management plans. Then we can have topical non-pharmacological treatment. Okay, topical non-pharmacological treatment. In other words, you can use, for example, gold weight, okay, to bring the eyelid down as a protective measure for the cornea. Remember, if the cornea remains like this for a long time, the patient might lose his or her sight. If you leave your food uncovered, germs will enter it and cause havoc. When you eat that food, you get diarrhea and you may die. So you don't want to lose the eyeball. You want to cover it. So there's a natural way of covering it. Okay, you can induce blepharoptosis and close the eyelid totally. Look at this other gentleman here. He can't close the eye. So if you use the gold weight in a surgical procedure to bring the eyelid down, then it will cover the cornea and stop the exposure keratopathy. Because other than that, the patient can go blind in that eye. Another method you can use is what? Occlusion. Okay, which can be in form of patching or taping the affected eye. What do I mean? You can occlude the eye with an eye occluder or a patch, okay, so that the eye ocular surface is not exposed to the environment like this. Okay, it should not be exposed to the environment. Then surgically, what can be done in facial nerve palsy? Well, we call something botulinum toxin. Botulinum toxin. It is capable of what? Weakening certain muscles. Okay, it's capable of weakening certain muscles so that the antagonist can take over and cover the surface of the eye and protect the cornea. So, if you have to use botulinum toxin, are you going to use it in the orbicularis oculi muscle or you use it in the levator palpebrae superioris muscle? Okay, ladies and gentlemen, if you use botulinum toxin in orbicularis oculi muscle, it means that you are weakening the orbicularis oculi muscle and the person cannot close the eye and the exposure keratopathy is going to be worse. So in which muscle will you use the botulinum toxin? It will be in the levator palpebrae superioris muscle, okay, which is the antagonist of orbicularis. So therefore, if you weaken the levator, then the orbicularis antagonist will have more strength in closing the eye ball and protecting the surface of the eye and then the cornea. There's another method that we call tarsorrhaphy. Okay, tarsorrhaphy. What is tarsorrhaphy? Tarsorrhaphy means that you use some material, okay, and then you use sutures and you close the upper and lower eyelid. You bring the eyelids together and suture. You suture the upper and lower eyelids together just to protect the surface of the cornea. And after a few months, the whole disease will have gone. There will have been recovery, in which case you can undo your tarsorrhaphy so that the patient will start seeing well in the affected eye. Well, students, I think that I'll bring my lecture to an end here. Keep reading and listening. If you have any questions, put them down. And when we meet in class, you can have more clarification to it. Until I see you again, stay focused and then stay blessed. Okay, bye.